Hi guys, welcome back to the channel. Today we discussing the CORTICUS trial. This is a landmark trial, hydrocortisone therapy for the patient with septic shock. My name is Dr. Buddhabhushan Borade. You can follow me on Instagram and YouTube. Medi Talk by Dr. Bhushan. You get a new chapter and new trials for the
Disclaimer: the content and information on this video is for education purpose only and is not intended to be recommendation of any kind of some whatever. Under any circumstances, the author accept no liable for any indirect, incidental, consequential, exemplary damages arises. This video may contain copyright material, the use of which may not have been specifically authorized by copyright owner. This video is available in an effort to advance understanding of educational content.
clinical question. In a patient with a severe septic shock, does hydrocortisone versus placebo reduce the mortality at 28 days? This is a design for the study. Multi-center study, randomized control trial, double-blinded, computer-generated block randomization stratified by the study center. All patients had a start corticotropin test to identify the responder from non-responder for a prior or subgroup analysis. Adverse event data collected by safety analysis to blinded interim intervals. Power calculation: if a 40% include were non-responder with a baseline 28-day mortality of a 50%, then 400 patients per arm were required to detect the 10% absolute reduction in mortality with 80% of power, 5% of accepted type 1 error. Setting for the study is a 52 participating ICU during the March 2002 to November 2005. Population for the study: inclusion adult with a severe sepsis with all of the following: clinical evidence of infection, systemic response to inflammation, shock, systolic BP less than 90, despite the 1 hour of fluid resuscitation or need for the vasopressor, organ dysfunction attributed to the shock. Exclusion: chronic steroid within a 6-month uses, acute steroid within a 4 weeks, immunosuppression less than 24 hours, survival expectation. 499 patients recruited, too much not patient recruited, less amount of data collected. Intervention: hydrocortisone given as a 50 mg in 6-hour boluses. Tapering the regimen from the day 6, stop on day 12. Control for the identical placebo prepared and administered in identical way to intervention. Outcome: primary outcome, no difference in 20-day mortality in short corticotropin non-responder, the subgroup that were more likely to benefit from the exogenous corticosteroid. 39.2 in hydrocortisone group versus 36.1 placebo group. Absolute difference is 3.1, favoring the placebo. P value is 0.69. Secondary outcome: no difference in 20-day mortality in short corticotropin responder subgroup were that less likely to benefit from the exogenous corticosteroid. You can read this data. Strength for this trial: excellent randomization and blinding methodology, sensible primary outcome and useful second outcome, fair commentary, compliments by authors and discussion section of paper. Weaknesses: despite 52 ICU, this study failed to recruit required numbers, averaged less than 10 patients per ICU over the 3 hours, despite the common incidence of severe sepsis. Actually, mortality 38% was much lower than the estimated mortality used power of calculation 50. Author conclusion: the use of hydrocortisone did not decrease the mortality in general population patients with septic shock, even though the drug has a reversal of shock. Bottom line for this study: the study did not demonstrate survival benefit from the administration of hydrocortisone to adult patients with a severe septic shock. It may lead to harm superinfection. It does not lead to reversal of shock quicker than the placebo. Based on the study alone, hydrocortisone should not be routinely given to adult patients with severe septic shock. It may be worth considering the when all yes has been filled. Thank you guys. Please like, share and comment. You can get this PPT. You can comment me your email ID, I will send it. Thank you guys.